Welcome to the series of Advanced Health. Today we're going to be talking about advancing medical research in the UAE and how we can take practical steps to make research happen in the UAE. So one of the things that has always captured my attention is how the medical industry works and how it comes up with innovation and how it deploys innovation and the different stakeholders that are part of this ecosystem. And it's a very complex network of things, of incentives, of companies, of scientists, of universities. A lot of countries try to be part of this ecosystem. Some countries do it very well, some countries try, but they can't make it. And today we want to talk about the UAE's take on research and how the UAE can play a role in that. And the past 16 or 17 years that I've been part of this industry, the last 3 or 5 years has been the most exciting, and it's mainly due to COVID. So COVID has been a great thing for the UAE in many ways. I think it made biggest stakeholders realize that for us to have access to innovation, we need to be part of making innovation. We need to be part of global clinical trials. And what does that mean? That means access to data, very clear regulatory path, receptive government, and many, many other things. And I think we have a very great example that Dr. Eric is going to talk about, how that has been made in an institution. And then later on, we're going to talk about the wider ecosystem of startups and how that is also equally important. So without me spending another hour talking about this, because I've been, again, spending a lot of time in this space, I'll give the floor to Dr. Eric, who's going to tell us more about what Sahha is doing in clinical trials. Thank you.
Thank you, Marwan, for the invitation, and it's a delight to be here. Yeah, so I'll talk briefly about Sahha and Pure Health and our plans for research. And as Marwan already introduced me, it's a pleasure to introduce this to the bigger world and to the wider world. I'll do a little bit about what we are doing, and then I'll go into a little bit more detail around what it actually means in day-to-day practice. It's really important to recognize what COVID has brought to us beyond learning more about infectious diseases, right, and how to cope with it. So what it really showed was highlighted the need to make sure that food and medicine are really sustainable over time. For a country like the United Arab Emirates, it's very important to make sure that those supply lines are secure, that we do enough research on it, that over time we'll be able to sustain ourselves, both in the sense of agriculture and food, as well as medicine and healthcare. And I think His Highness Sheikh Mohammed bin Zayed highlighted this. Food and medicine are a red line for the UAE, and we have the ability to secure both indefinitely. That's a really key thing, we have the ability. And that's what I want to focus on today in terms of Pure Health and Sahha. For those of you who don't know Pure Health, and I know this can be a little bit confusing at times, it's been a very, very exciting time for us over the last, 6 years, grown exponentially in terms of medical labs, in terms of hospitals, clinics, pharmacies, RAFID as a largest procurement agency. I always miss out a few. Pure CS as one of our IT companies. So what we do when we combine it all, and Daman, of course, as one of the largest health insurance in the region. What we have, when it comes to the research, and under the umbrella, I guess this is a poor drawing of an umbrella, but under the umbrella of Pure Health, I represent a lot of these entities. So 25 plus hospitals all across the United Arab Emirates, because we have a contract with the Ministry of Presidential Affairs to operate the hospitals in the Northern Emirates. About 25 plus of them, 100 plus clinic. The plus is always important because it always grows, right? So the moment I create this slide, the next week there's another plus somewhere else, right? So that's why it is a plus. 160 laboratories, again, all over the country. About 2.8, almost 3 million members insured through our demand health insurance, and around 18 million encounters annually. So that's the kind of the platform that we work from. And then when you look at it from a research point of view, we see like around 40 plus active clinical trials. Again, that's the plus. It changes by the week almost. It's a significant investment for us and a real delight to have some of the key stakeholders here from PDC and IQVIA and others. And thank you for your support. Around 200 plus principal investigators. So these are doctors, nurses, allied health, sometimes people like me, more on the health research management, on the health management side. 3,500 plus physicians, more than 8,000 nurses. And we offer unrivaled capacity in terms of data, access to patients, access to our physicians and our clinical personnel. And that's across the whole UAE. One of the things that I always asked about is the data. You know, we sit on the top of huge amount of data, especially in SAHA, where there's over 14 years of data from in a relatively structured format through our electronic medical record Cerner. Partnership with major academic institutions, and I want to kind of highlight today the largest clinical trials unit in the region, which is in Abu Dhabi, Abu Dhabi Health Research Center, and we have over 4 million unique patients. So this is kind of where we're at in terms of the logos, and I know logos don't always paint the right picture, but these are kind of the logos that some of you may be familiar with, both in Abu Dhabi as well as in the rest of the United Arab Emirates. We have One Health as a distribution company. On the right, the ones that are in the frame there is where I'm focusing on in terms of us as a research unit within SAHA, and beyond SAHA we will hopefully grow. So SAHA is probably one of the largest integrated networks in the United Arab Emirates or in the region, and we want to support research from there on in and build it up so that we can include all our assets eventually. So it's one central dedicated research team for SAHA supporting all the research activities. So next one, this is just a highlight. Marwan was there a couple of months ago. This is one center that we converted into a specifically dedicated research center, dedicated to all kinds of research. Clinical trials have been carried out there. So this is another legacy, a good terms of legacy from COVID's point of view. As you may have participated yourself in some of the clinical trials. We had, I think at the height of it, in total, I think it was around 60,000 people involved, participants. So the latest one that we've just closed off was 14,000 participants. So these are huge clinical trials that need their own dedicated facility. I'm not out here to get any sponsorship today, but if you are interested, this is quite unique. If you want to do a clinical trial at scale, this is the perfect location. We have consultation rooms. We have a completely set up, as you can imagine, with a normal center, plus, because it's quite big. It's 16 consultation rooms, a lab, a dedicated pharmacy. We have an emergency care or a urgent care area as well. We have meeting rooms. It's all dedicated in the Al Bateen area near SKMC. It's affiliated to SKMC, fully licensed, fully equipped. The best thing about it is the people. The people are unique insofar that they've done clinical trials over the last 3 years, about 50 of them, about 30 nurses, 14 doctors, I believe, about 5 allied health personnel, registration, and it's all integrated within our Cerner platform. So that's quite a unique proposition. Again, it can be, we're doing a clinical trial now for 40 participants, but it can go all the way up to tens of thousands of participants. And we're actually doing one for Pure Health Group as a clinical partner, onboarding about 2,000 participants who go through a 3-month rigorous trial of more around the wellness side. So I don't know if you've noticed the Pura app being launched recently. That's as a kind of a direct result of the work that we've done on behalf of Pure Health, bringing in people to the center, normal people, regular people, no chronic diseases or anything, and see what we can do over a 3-month time frame in terms of their improving their health through mainly lifestyle opportunities, but also highlighting the risks that they have and projecting something around longevity for them. Yeah, that's over 2,000 people participated, over 1,000 teleconsultations. What was interesting with that as well, we can do mobile clinics. So we did it over 11 different centers across 6 Emirates, yes. The only one missed out was Sharjah, but that may come someday as well. And it's a fully integrated clinical partner for current trials. And these are some of our partners. Some of them you know, some of them you may not know, internationally and locally. And this is kind of the framework that we work from. Obviously, being a Pure Health as a national player, we have benefited greatly from the UAE kind of plans, the overall plans, including MOHAP as well, which I should mention as well here today. And Abu Dhabi, when you look at the Abu Dhabi government and the economic vision for 2030, and it's particularly around what the Department of Health is doing, which is kind of building a health and life sciences hub, which is not necessarily a physical location, but multiple physical locations, which will be an integrated network, or already is an integrated network. So as I showed you the previous slide around the partnerships, we have a lot of partners that we just work with as a clinical partner, as a support function, and that goes across all of the entities in the United Arab Emirates. This is just a summary slide. We have over 300 publications per year. We have a dedicated legal and finance team, over 40 clinical trials. Don't know if you can see it at the back. We have all our research centers are authorized by the regulator. And we have, as I said earlier, we have over 200 experienced researchers. And yeah, please contact us. We're here to support you. We're here to support this country, not only this country, beyond this country, in terms of making an impact in medical research and making an impact in terms of innovation. And it doesn't matter how small it is or how small the idea, whether it's an early stage development or a very much an end stage development, we are here to support it, whether it's paid for, hopefully, or unpaid for. There is room for everybody in that. And that's why I'm so happy to be here today. I'll hand over to Mr. Saeed.
First of all, thank you for giving me this opportunity to come and talk. And I think it's a great time for UAE, as Marwan said, and for us all to look into health and the science sector in a different perspective. I think in the past few years, we have seen a lot of companies coming into UAE and opening more advanced research and also manufacturing and R&D. And I'm proud to be here and work with a lot of industry players and startups as well. I come from a research industry. I started as an engineer, and then I went into research. And today I lead N5, which is the business incubator of TCOM Group. How N5 started was 10 years ago, when our management started to see a lot of companies that are coming through, maybe, the likes of Souq, the likes of Anghami, coming into the industry and starting to, find their feet into the entrepreneurial ecosystem. And this is when our TCOM management started supporting these companies and saw the opportunity to support more companies who are coming in. So we saw that this is the companies that we want to support. So we started 10 years ago as N5 Tech to support technology coming through. And then from there, we started to develop more organizations. What we decided is to build a platform to pump in as much as innovative and creative companies into the sector. And this is where we started with technology, and we supported Anghami and Souq and more companies that came through. We have a company that got acquired by Cisco in 2017, and we continue to see so many starting from UAE and going out globally as well. So like I said, we started from technology and then moved into media and then design. And this year we launched N5 Science. And this is why I'm here today to talk to you about N5 Science, but I'm gonna go into how the journey was. So N5 in numbers, like I said, we started 10 years ago, and we have 3 incubation centers across Dubai in our business parks. And currently we're working also with Dubai Science Park to launch our 4th one. Still in discussion, what do we need from this facility? So I'll show you some examples of what type of facilities that we have. Our startups have raised more than, in the past 10 years, 2.5 billion in investment. And we are one of the biggest incubators in the country. We have more than 400 plus startups. Specifically, like Eric said, the numbers always increase. But today we have 425 companies across the 4 sectors. Of course, from this business incubator, we subsidize all the services. So the license, the co-working and everything, we bring them in one roof. And the objective is to bring like-minded people so they can work together and collaborate in one roof. Because, sometimes being an entrepreneur is lonely. And of course, we do annual workshops, we do events, and of course, a lot of job creation has been happening. Now, these are the four sectors and the companies that we have. One of the companies, as for example, Ice Tech, is a health platform that you can scan or take a photo, and it can tell you your let's say fatigue level and vitals, what issues you have. So this is an innovation that is coming out of N5, still work in progress, but of course we have many companies across, and these are the sectors like healthcare, AI, Medicare, sustainability, green. So when it comes to science, we're trying to support across the board. But of course, at a later stage with the community, we'll look to see which areas to develop, let's say like maybe physically wet labs for the startups or something else to do with AI. But as we go, we want to listen to our community, people like you, to also contribute in our development and order what facilities we should develop. And of course, other sectors, like I said, I'm sure most of you know Tabby. Tabby is one of the startups who have come from N5. This is the wider community, so we work with everyone. Most of the top companies, of course, are across our business parks and the likes of Cisco, Microsoft, even in Science Park, you guys as well. So we look to integrate our startups, incubators, universities with prestigious companies so we can work together as a community. Like I said, how do we set up? Is basically an incubator that houses all these startups, and we subsidize most of the services. So they come in, we tell them don't worry about anything, and we subsidize their licensing cost, we subsidize their co-working cost, and we do a lot of networking events. Some of you, I'm sure, are attending some of our workshops and events, and we participate in all the events across the globe. And the objective is, like I said, bringing everyone together so we can discuss about collaboration, support, and so on, and also support these new startups when it comes to also funding, collaborating with businesses so they can stand on their feet. Because it's really difficult for innovators or people who are doing research to come in and go into the business world. So we are there to support them, and any support that we have and from the industry, we try to give it to them. So this was our launch in N5 Science. We're still working on a lot of things that are developing. Also, we are in not only health, we also in the sustainability and other sectors of science. These are 15 companies. We always said they are tech, but when we came and launched N5 Science, we noticed that we have all of these companies. So some of you might know them, and I urge you to look into them and see what maybe you can collaborate with them. I'm happy to connect you with them if it's of your interest. And they're spread around so many sectors. So you have health, we have vertical farming, we have we have companies that are fixing the challenges when it comes to air conditioning as well. So there is a lot of things. So we'll show you some of our innovation centers and how they spread out. So we have Dubai N5 Tech. We started from a small villa, but we could not, we had to grow. Today, this is most of our startups. I would say 70% of the startups actually are tech companies. These are our facility, and this is a lot of events that are happening over there in our facility. N5 Media, we have the offices and also the facilities for them. And the objective, because when we started 10 years ago, we were the only ones in the ecosystem. So we had to build the facilities that these startups needed. The objective is one-stop shop for you to do everything. And this is why for the media sector, we provided that. And we look to do this in science as well. This is N5 Design. Maybe you've been to this facility. We have the prototyping lab. So for all the machinery, we have a robotic arm, 3D printers, CNC machines, the wood shop, everything to cater to people who are designing products. So 10 years ago, I had a deep tech, a hardware startup, and I struggled to find facilities like these. And this is the opportunity for even science companies to come. And these are, accessible and affordable pricing for people or the community to use. So this is it from my side. And like I said, we look to collaborate with as much as people as possible, because we believe now, maybe previously we were far back, but of course we have a lot of scientists from UAE, from globally. There also R&D centers are opening right now. And we want to be at the center of that and try to collaborate with as much as people as possible. I'm really excited because I'm working closely with Marwan to do a lot of this work, but of course, having the wider community as well. So hopefully maybe we'll have wet labs or whatever. Even your advice will be beneficial for us to see what we can get in, so we can bring in a pipeline of thousands of startups in this sector. Thank you so much.
Thank you very much for those very informative presentations. It's really good to understand perspectives from Abu Dhabi and also what's going on within Five. Very interesting. So Eric, I'd like to put the first question to you. What do you believe are the most significant challenges facing medical research globally and particularly in the UAE?
The most important challenges, and this may surprise people because people kind of expect an answer that goes into the kind of tough challenges that are ahead when you implement or when you manage a clinical trial. I believe globally the most important challenge is that medical research or clinical research or health research, you're testing hypotheses, right? So you're testing something that you think is going to work to the benefit of us as humans in this case, right? So it's human subject research. And in that instance, I think what we know for a fact for the last, I think since we've been on the planet is that actually it's not typically medicine that works the best, right? So when I do lectures, when I give lectures, I always teach about what's called the social determinants of health, or the determinants of health. So what surprises people is that actually healthcare, the quality of healthcare, only determines probably about 10–15% of how long you live, how healthy you are. The most important things are what we can control ourselves. And that kind of takes a paradigm shift. So what we can control ourselves are the things where, we can exercise more, we can sleep better, hopefully, we can eat healthier, we can make the right choices at the right time. Unfortunately, we don't always do it, right? And that kind of determines probably around 50–60% of our health. The rest is kind of determined by your genetics and your environmental factors as well. And quite a lot of it is determined by your social, economic factors. But when you look at that then in terms of the challenge that we're faced with, actually the challenge is that clinical research or health research or medical research, most of the money goes towards tablets, medication, treatments, diverse treatment, which is all good. I'm not dishing it. But you can almost think about, well, if that only determines about 15–20% of our health, what about the other 85–80%? And what are we doing on that? So it's a call really to action. I believe that we are doing some of that ourselves. I showed you the example of a trial we're currently on the way. So that's kind of the global picture. From a local picture, you're going to go into more of the processes and the people. So the people first, we believe we have quite a high standard in terms of number of researchers that can participate as investigators, principal investigators, clinical research associates, clinical research nurses. However, it's still lower than where we could be. And that's the kind of the sustainability issue. That's the people. Capacity building for me is one of the biggest challenges on a daily level. The others, and we have to a certain extent we have control over that, but it's more of a long-term control. So we're going to have to work with the likes of the Khalifa University who want to do a clinical research program, Masters in Clinical Research, which we will fully support. The other thing is more around the processes. So processes are more, you can make a change every day in terms of making sure that, a clinical trial ends on time, or a clinical trial gets enough participants, recruits enough participants. There are some tangible things, or that a clinical trial gets approval on time. They're all tangible things we're working on now with the regulators, with the system around us, with CROs, contract research organizations, with pharmaceutical companies to make sure we actually control those processes and actually outperform some of our global competitors when it comes to other countries in the region. And that actually lifts up the whole sector, I believe. And this is, as Marwan already said, this is an industry that's growing quite fast and quite rapidly, and we will hopefully together be able to address some of those challenges.
Thank you very much, Eric. Saeed, it's really interesting to hear about how In5 are incubating across so many different sectors. And I think it puts you in a unique position to integrate between sectors as well. And I think something that's being talked a lot about in healthcare is the emergence of AI and machine learning. And where do you think that, they're becoming increasingly prevalent, but where do you see these technologies shaping the future of medical research and patient care?
Yeah, I think like what you said, the most interesting part is when you integrate the four sectors together and they tend to collaborate and work together. And this is what makes it interesting. So you have the, let's say, clinical people or the medical people who come from the medical sector, and then they integrate with the people from tech, and they start to work together to create solutions. So sometimes we see people who come from the industry, and then they start to adopt these systems. So we have a couple of startups who are actually using AI and medical, right? For example, like I said, Ice Tech, they are actually using AI and medical and trying to find this solution, giving us a result to people. And nowadays, I think it gets more sophisticated as people start to adopt AI. Of course, we have some who don't want to, but we have a lot of them are looking at this. In order for us to contribute. Of course, some of them don't reach that level of creating medicine, right? But they are able to use technology to do that. We've seen a couple of startups who came in who were able to detect COVID before even you get it, before even the symptoms, by monitoring your vitals and so on. And we continue to see that. But the question is the medical industry ready to adopt these technologies, and how fast they could be adopted? But we have seen an increase of number of companies in the scientific sector. And I think this is an industry that has a lot of research and people locally who are studying in the medical research industries, and deep as well, they're clinical. Comparing to tech, if you looking at Dubai Internet City, most of the companies that have come in first started selling to the industry, so more of a selling. But in science now, we do have a lot of people who are very technical and in the research. So here is the creation of the technology is easier, and adopting these technologies is easier because you have people locally who are adopting these technologies, and they have that experience. We have a guy who is working on detecting cancer, and he came from a big company, and he said that I want to do this for my region, right? So he came in, left the company, and he started to create something similar over there, but specifically for our region here. And he started to adopt the AI and all the latest technology into it. So there is a lot of things that are coming in and exciting, and I think if we are in the industry, I think across the board, if we are going to see something new, it's 100% going to come from the science and health industry.
Thank you. I think it sounds like it's a very promising ecosystem for future research and innovation. Marwan, I'll come to you now. You mentioned in your introduction that COVID-19 had paradoxically been a good thing for the UAE healthcare system in terms of the way it had to rapidly innovate and kind of it drove research and trials. How can we sustain that, level of collaboration and acceleration through other therapy areas and diseases and healthcare challenges?
That's a very good question, because I think when we were dealing with COVID, it was also a state of emergency, and everybody was on the same page and wanted to have a resolution as soon as possible. I think there was a big realization that was triggered by COVID, and that was like I mentioned, that to be part of to have access to innovation means that you need to be part of the making of innovation. So that was something that I was preaching for a long time, and I didn't have lots of ears, but it was it was a realization, and I think we need to have programs like N5 Science, like what Dr. Eric is doing, to sustain that and to make it actionable, accessible, and reachable, not only to companies that are here, but also people who want to access that from other regions and other markets. So I think to answer your question, we need to continue to work together. And it's not only the government or the private sector, it's really everyone working in harmony. And we need I think each of us has a role to play, and we need to continue doing that.
I agree, thank you. Eric, talking about public-private partnerships, I think funding is always a big challenge in medical research anywhere in the world. How important has it been to foster public-private partnerships in your experience? And can you give us some examples of where it's worked really well?
Let's start talking about the United Arab Emirates first, because I think when people come to this region, they don't always understand the difference between public and private. I think having been in the region for 13 years, probably they still don't understand it fully. But the good thing about that is, whereas people may say, well, gray is not a good thing, it's not black and white. The good thing about it is when you see it on the day-to-day basis, and we saw it during COVID, that's probably the best example, where the government actually was very, very, very responsive to the needs in the population to do both PCR testing, as you probably remember these times, as well as vaccination programs, which is all more or less public funded, but privately executed by the whole community of different players in terms of the healthcare provision point of view. That was a really good example whereby the public funds were utilized in partnership with private companies, including our Pure Health group as a group. I think that's not the standard way of doing things. I think what we've seen from it though is that there's more of an appetite to kind of say, let's have a grants-based system in place. Government grants are really, really important in research to motivate our own population, our own staff, to actually do that. I think we talk a lot about clinical trials coming here, global clinical trials at global scale, which we do, and we're very happy to have partners like IQVIA here, or PDC, or other partners, all the AstraZenecas of this world. They're all here. They're based in Dubai Science Park. That would really sustain ourselves. But I think when it comes to the actual research that is focused on, built by the UAE with partners like N5, it's kind of key to have some government funding is probably where people focus on. Time and expertise and data and patience. They're the type of things that I find on a day-to-day basis is almost as valuable as giving a grant. The grant always does a lot of things in terms of giving publicity around it, giving recognition to the people who deserve it and who've applied for a grant. And we've seen that in Abu Dhabi, at least, the Department of Health has recently launched a scheme. We're obviously part of Abu Dhabi, the holding company, ADQ. They have a grant scheme for their companies. So we see Khalifa University doing something similar. So we see that, and we're benefiting from that in terms of our staff are participating, our patients can get access to some of that research, ourselves as an organization, we learn to that. I think that will increase, so that's more the public funds, but I think the private side of it is more of the time and the efforts that people put in. And that includes recruiting participants, for example. That's a very not often discussed topic, but it's a challenge, and it can be a challenge, and you need to put effort into it. You need to teach and educate your nursing staff, your registration staff, your doctors, to make them aware of, hey, there is a clinical trial out there, would you like to participate? So I think that doesn't really fully answer your question, but it gives you a flavor about the boundaries and the participation. And what's really nice here in terms of having, this panel, but you can go to any day of the week almost, and you have a similar panel like the four of us here. And people talk about it quite actively. And there's an open door policy, as at least in my experience, whether it's MOHAB, whether it's DHA, whether it's DOH, we're quite connected already, which makes it quite easy and especially this is a global role, they're very surprised that the regulator is so supportive, or that the service provider is so supportive, or that you can meet a healthcare professional with, with 20, 30 years experience in a particular field, and you can meet them the next day. That really helps in terms of making a networking opportunity into a real valuable value proposition. That helps in clinical trials, and I think now the government with the MOHA publications, the DOH, the DHA's effort, it's lifting it in terms of a different landscape. So you have both internally funded or internally within the UE funded, as well as the tried and trusted clinical trials that we've already conducted over the last, I don't know how many years, 40, 50 years, and we will see that increase. So I think both of them relate to the same topic, which is how the public funds or the publicly funded entities are supportive in this, and then that helps with a private partnership point of view.
Thank you very much. With that, I'd like to bring the session to a close. Thank you very much, Eric. Thank you very much, Saeed and Marwan, for your contributions today. Thank you, everyone, for attending. It's been a really fruitful, interesting discussion, and I hope you've all benefited from it too.